Welcome to Medicare 102, Medicare Secondary Health Insurance and Prescription Drug Plans, presented by the Mesa County RSVP SHIP program. For the best views on this cruise, click on the full screen square at the bottom right of this video. Many of you have sailed with us before on the cruise called Medicare 101, Introduction to Medicare. During that cruise, we touched briefly on the approximately 250 choices for secondary health insurance and approximately 40 choices for prescription drug plans.
On this one-hour cruise, we will wade through the tsunami of brochures in your mailbox and email account. By the time you disembark from this cruise, you should have a good idea which secondary health insurance and drug plans best satisfy your budget and medical and medication needs. We will also look at some financial assistance programs that might help reduce the cost of medical care and medications. If this class generates additional questions, please contact the Mesa County SHIP office by phone or email to set up a one-on-one counseling appointment with a trained and certified SHIP Medicare navigator. You reach this Medicare 102 cruise through the Mesa County RSVP website. Mesa County RSVP works in partnership with about 60 local organizations to fill important volunteer needs by recruiting individuals 55 and over. The Mesa County SHIP SMP program is one of those organizations benefiting from RSVP. So if you are looking for volunteer opportunities in Mesa County, contact the RSVP volunteer manager and consider joining the more than 600 RSVP volunteers making valuable contributions to our wonderful valley. The RSVP volunteer manager can be reached through the phone numbers on the RSVP site or this SHIP site, or the email on the RSVP website. This Medicare 102 cruise is presented by the Mesa County SHIP SMP program. SHIP, which stands for the State Health Insurance Assistance Program, and SMP, which stands for the Senior Medicare Patrol, provide free, personalized, and unbiased help on Medicare and Medicare-related issues. We will give you our unbiased analysis of all the secondary health insurance and drug plan options available to you. Our Mesa County SHIP was launched into these murky Medicare waters in 2008 and currently sails with one RSVP staff member and 8 trained and certified volunteer navigators. Last year, we counseled and educated more than 2,500 clients in this area on Medicare and Medicare-related issues. Although our classes and counseling are free, about half of our operating budget comes from local agencies and individuals like you. So if you find our services to be valuable, please donate to our program by sending a check to the address shown on this slide or pushing the donate button on this website to help keep the Mesa County SHIP program afloat in the murky Medicare waters. Let's start this cruise with a brief review of Medicare so you can see how the secondary health insurance and drug plan pieces fit into the overall Medicare program. Time to set sail for our first port, Original Medicare. There's an awful lot of detail on this Medicare overview chart, but my goal in this cruise is to show you how the 3 parts of Medicare fit together. Medicare does consist of 3 parts. Everyone enters Medicare through Original Medicare Parts A and B, shown in the upper left section of the overview chart. Original Medicare covers about 80% of medical costs because of the deductibles, co-pays, and co-insurance inherent in Original Medicare. $1 million of medical costs in a year is sadly possible for you or me. Original Medicare will pay about 80% of the bills, or about $800,000. That leaves about $200,000 of medical bills to be paid by you, a daunting financial burden. Medical costs are the main reason why seniors file for bankruptcy. So most will get a secondary health insurance policy to cover part or all of the remaining 20% not covered by Original Medicare. Options are shown in the lower left section of the overview chart. You have several hundred secondary health insurance options, group options or private insurance options like Medigap and Medicare Advantage. We will be wading through these options during this cruise in search of the best health insurance secondary policy for you. The third part of Medicare is prescription drug coverage. Options are shown on the right part of this chart. You have more than 40 drug plan options. We will also be wading through these options on the Medicare 102 cruise. But first, to Original Medicare, which you need to get before enrolling in a secondary health insurance plan and a prescription drug plan. Original Medicare consists of Part A, generally called a hospital coverage, and Part B, generally called medical coverage. Part A of Original Medicare, or hospital coverage, covers inpatient, hospital, recovery from the hospital stay, and hospice. Part A is free for most Medicare beneficiaries. About half of your medical costs will be addressed by coverage under Part A. The other half of your medical costs will be addressed through coverage under Part B of Original Medicare. Part B covers other medical services such as doctors, outpatient surgery, durable medical equipment like oxygen and wheelchairs, laboratory tests, and others. The current standard premium for Part B insurance is $144.60 per month. Original Medicare will cover about 80% of your medical costs, so it's important to enroll in Original Medicare when you are eligible. You can learn more about who needs Original Medicare, when to enroll, and how to enroll in the Medicare 102 cruise through a link on this website. Although secondary health insurance only addresses the remaining 20% of your medical costs, that 20% will often be a budget buster. Therefore, most will get a secondary health insurance policy to pay part or all of the medical costs not covered by Original Medicare. Options are shown in the lower left section of the overview chart. There are group plans typically provided by a current or former employer and private plans called Medigap and Medicare Advantage. So let's sail for the island of secondary health insurance. As your cruise director, I want to warn you that we've just alerted with that ship horn the hordes of insurance companies and agents waiting to greet you upon our arrival on the island of secondary health insurance. Or perhaps you already know by looking at your mailbox or email account. You will be pestered by brochures, advertisements, and offers that sound too good to be true. So here is a recommendation from your cruise director. Grab a pina colada or other beverage, settle into a comfortable chair on the island's beach, and listen to what your cruise director has to say about the positives and negatives of these secondary health insurance options. There are 3 ports on this island of secondary health insurance. but we are going to visit only two of them on this Medicare 102 cruise: Medigap and Medicare Advantage. The third port includes group insurance plans which go by the names Para, VA, TRICARE, FEHB, Active and Retirement, Employers Insurance, and Medicaid. These were addressed in another cruise, Medicare 101, Introduction to Medicare. If you feel like you want to learn more about these group plans, sail on Medicare 101, talk to your HR department, or set up an appointment with a ship navigator. The two ports that we are going to visit on the island of secondary insurance are Medigap, also called Medicare Supplement Insurance, and Medicare Advantage, also called Part C. There are about 250 Medigap choices and 10 Medicare Advantage choices in our area. How to choose the best one for you? We are going to dive into the Medigap and Medicare Advantage choices in detail in this Medicare 102 cruise. The choice of the best secondary health insurance plan for you can save you thousands to hundreds of thousands of dollars in medical costs while you're on Medicare. If you want additional information on Medigap and Medicare Advantage plans beyond what is offered on this cruise, go to the resources listed on this slide. Many who take this cruise make an appointment with one of the ship navigators by calling our number at 970-243-9839, option 1 on the phone tree, or sending an email to shiphelp@rsvpgrandjunction.org. There you can review the information from this cruise, review additional information available to ship navigators, and confirm your secondary health insurance choice. The next groups of resources on Medigap and Medicare Advantage plans are available through links on this website. The State of Colorado Department of Regulatory Agencies, or DORA, puts together a document on Medigap or Medicare Supplement plans. This document provides a description of Medigap plans and lists all the plans available in Colorado and their monthly premiums for Denver residents. In another Medigap reference, our Mesa County SHIP has prepared a document that lists the least expensive Medigap plans for a 65-year-old non-smoker in our area and presents additional information on the companies offering those plans. Both of these Medigap plans are available through links on this website and will be covered on this cruise. To find out more about the Medicare Advantage options, go to Medicare's Plan Finder at the website medicare.gov. At that site are provided details on all Medicare Advantage plans available in your area. Or you can review the summary we've prepared on Medicare Advantage plans in our area. Both of these Medicare Advantage plans documents are available through links on this website. Finally, you can go to insurance agents trained in Medicare secondary health insurance. They can provide you great information on their clients' experiences with certain plans, as well as enroll you in a Medigap or Medicare Advantage plan. Recognize, however, that the insurance agent can only sell you the set of Medigap and Medicare plans that she or he represents. You will learn that Medigap and Medicare Advantage plans are fundamentally different, and yet they have some of the same requirements and considerations. First, you must have enrolled in original Medicare Part A and Part B before you can sign up for a Medigap or Medicare Advantage secondary health insurance plan. Second, you should verify that your doctor and other providers will accept your plan, particularly if you select a Medicare Advantage plan. A significant percentage of primary care doctors, labs, and home health companies locally will not accept a Medicare Advantage plan. Third, you must live in the plan's service area. For Medigap, this is the United States, and for Medicare Advantage, the service area will vary from plan to plan. Fourth, each type of plan has periods when you can enroll, and we'll discuss those later. Fifth, the secondary insurance plans, Medigap and Medicare Advantage, are designed to pay part or most of the medical costs not covered by Medicare. The degree to which each covers those costs depends on your plan choice. Next, you may want or need a prescription drug plan. No Medigap plans cover prescription drugs at the pharmacy, while most Medicare Advantage plans will include prescription drug coverage. We'll discuss prescription drug coverage later in this cruise. And finally, you'll typically call an insurance agent to enroll you in one of the Medigap or Medicare Advantage plans. Approximately equal numbers of Medicare beneficiaries enroll in a Medigap plan and a Medicare Advantage plan, both nationally and in Colorado. Medigap plans appeal to a different group than Medicare Advantage plans. The fundamental differences are illustrated in this chart. Medigap plans have higher monthly premiums, but lower deductibles and copays than Medicare Advantage plans. Therefore, Medigap plans tend to appeal to the chronically ill who do not mind paying the higher monthly premium in order to reduce the financial burden of deductibles and copays for medical services. Medigap plans are better for snowbirds and frequent travelers because they do have a national network. Medigaps also have more options for specialists because any provider that takes Medicare will take your Medigap plan. If you have a Medicare Advantage plan, you will typically have a plan network for services provided from doctors and other specialists. Finally, Medicare Advantage has more preventative benefits, like some dental, vision, and hearing benefits, and usually payment of your health club dues. Medigap plans generally have no preventative benefits, but focus on payment of medical services. Those are the general differences between Medigap and Medicare Advantage plans. That general information may allow you to decide whether you want a Medigap plan or a Medicare Advantage plan. But how do you choose the best plan out of the 250 Medigap choices or the 10 Medicare Advantage choices, and when do you enroll? The tsunami of brochures and cacophony of advertisements will not give you the information needed to choose the best plan for you. We hope this cruise will. So let's take a tour first of Medigap or Medicare supplement plans on this island of Medicare secondary health insurance. For those of you in the Medicare Advantage camp, just cool your tools and we'll take that tour later before we leave this island. So when to enroll in a Medigap plan? You have guaranteed enrollment in a Medigap plan up to 6 months after enrolling in Part B. Most who are retired will enroll in Medicare Parts A and B and get a Medigap plan when they first become eligible for Medicare at age 65. Most who work past age 65 and are covered by credible employers insurance will delay enrollment until they retire for Part B, for original Medicare Part B, because then they will have guaranteed enrollment in a Medigap plan for up to 6 months after retiring and enrolling in Part B. You will enroll in a Medigap plan through an insurance agent. Ship navigators are not insurance agents and therefore cannot enroll you in a Medigap plan. Guaranteed enrollment is extremely important for those who want a Medigap plan and suffer from chronic illnesses. If you miss the Medigap guaranteed enrollment period, either the initial enrollment period or the special enrollment period, you will have to go through medical underwriting. That means that the insurance company can decide not to enroll you in a Medigap plan, charge you more than the general market, or put a pre-existing condition on your coverage for up to 6 months. It may be difficult to pass medical underwriting and get a Medigap plan if you have diabetes, heart disease, cancer, or other chronic condition. So if you have a chronic condition and decide that Medigap is a better option for you, do enroll in it when you have guaranteed enrollment. Why might you prefer Medigap over Medicare Advantage? Because it better covers your medical needs in the ways listed on this slide. There is no network for Medigap plans, so it is a better option if you are a snowbird or travel frequently. A Medigap plan opens the entire universe of specialists who accept Medicare. Medigap plans have fewer deductibles and copays, so medical costs are generally lower for the chronically ill, and bills are easier to understand. Finally, as we've discussed before, you will probably not be able to switch from a Medicare Advantage plan to a Medigap plan when you become chronically ill and want to benefit from its fewer copays and deductibles. Remember, you will be outside the guaranteed enrollment period, and an insurance company can consider you to be too bad a risk for a Medigap plan. Why might you not choose a Medigap plan? First, because you're going to pay a significant monthly premium in the tens to hundreds of dollars per month, whether you are healthy or sick. And those Medigap premiums will increase with age and inflation, while Medicare Advantage plan premiums are the same no matter what your age. Medigap premiums have gone up about 5 to 10% per year as you get older. Second, Medigap plans lack the dental, vision, hearing, and other health club benefits inherent in Medicare Advantage. Only a very, very few Medigap plans offer any preventative benefits, and the benefit is usually payment of health club dues. So if preventative benefits are important to you, you may be more interested in Medicare Advantage than Medigap. There are about 250 Medigap plans offered by about 50 companies in the state of Colorado. How do you possibly choose the best one for you? Not from brochures and advertisements that you're being fed at this port. The secrets are: 1. In this document, Medicare Supplement Insurance Policies in Colorado, published in late August of each year by the Colorado Department of Regulatory Agencies, or DORA, and 2, in a summary document prepared by this Mesa County SHIP on the least expensive Medigap plans available for a 65-year-old. Both of these documents are available through links at this website. If you are in the Medigap camp, how do you winnow down the 250 Medigap plans to the one best for you? First, decide how much coverage you want and can afford in your Medigap plan. Medigap plans are designated by letters A through N, and each letter has a certain level of coverage, as shown on this chart. The most popular plan by far nationally, as well as in Colorado, is Plan F. In the past, about 80% of those enrolling in a Medigap plan have chosen Plan F. It offers the most complete coverage, but the highest monthly premium. Notice the check mark in every row of this chart from the DORA document under the Plan F column. All your medical costs are covered by original Medicare Parts A and B and your Medigap Plan F. Unfortunately, for those of you getting into Medicare in 2020 and later, Plan F is no longer available. Also not available are Plan C and Plan F High Deductible, which are similarly comprehensive plans. Medicare found that those who have Plan F have medical costs about 37% higher than those with other Medigap plans because they have no skin in the game. If they need to have a surgery, no cost. If they go to the emergency room, no cost. So in order to try to control Medicare costs, Medicare has eliminated Plan F as well as Plan C and Plan F High for those getting into Medicare in 2020 and later. The three most popular Medigap plans now are shown on this slide. Plan G is just one step down from Plan F. It pays all your medical costs not paid by original Medicare, except for the Part B deductible, which is set at $198 for this year. The Plan G premium for a 65-year-old varies widely from about $100 per month to about $400 per month, depending on what company you choose. Another step down from Plan G is Plan N. It covers all medical costs except for the annual Part B premium, $198 this year, and you'll also be charged $20 copay each time you go to the doctor, primary or specialist, and $50 each time you go to the hospital emergency room. Premiums for a 65-year-old range from about $80 to $280 per month for a Plan N, also depending on which company you choose. Another plan named G High Deductible, or G High, is popular for those who are generally healthy, don't want to pay the high premiums of other Medigap plans, but want the easy access to medical care offered by Medigap plans. The G High plan operates like a G plan after you meet the plan annual deductible, which is set at $2,340 this year. Because original Medicare pays about 80% of your medical costs, you will pay about 20% of each medical bill until you reach the plan deductible. This happens at about $12,000 of total medical costs. So consider Plan G High as a high deductible catastrophic insurance plan. It doesn't kick in till you have about $12,000 in total medical costs, but it limits your annual liability, deductibles and copays, to a $2,340 plan deductible, a $198 Part B deductible, for a total of $2,538. The premiums for a 65-year-old for Plan G High are much lower than other Medigap plans, and they range from $30 to $60 per month, depending again on which company you choose. Now you should have a pretty good idea of what level of coverage you want from your Medigap plan, Plan A through Plan N. There are about 50 companies offering Medigap plans in Colorado. How do you choose which company? All Medigap plans of a certain letter have exactly the same coverage, but the monthly premiums can vary greatly from company to company. For example, Medigap Plan G has exactly the same medical benefits at Company A and at Company B, but the premiums for Medigap Plan G will range from about $100 for the least expensive company to about $400 per month for a more expensive company for a 65-year-old. Premium ranges for Medigap plans with other coverage levels are similarly wide. I am one of those who shudders to ask what the person next to me has paid for his seat on the plane. Why should I pay more than him? Because we're going to the same location, get served the same stale crackers and water, and arrive at exactly the same time. So why should I pay more for my seat than my neighbor? And similarly, why should I pay more for my Medigap plan than another with the same plan, but one that he received from a different company? This Mesa County SHIP has put together a list of the companies with the lowest premiums for a 65-year-old non-smoker in Mesa County for the three most popular plans, Plan G, Plan N, and Plan G High Deductible. The list as of August 2020 is presented on this slide. A more current list may be available through a link on this website. If the lowest premium is important to you, choose your Medigap from the short list of companies in this table. Phone numbers to reach a national registered agent for the plan that you want are listed for all Colorado plans in the DORA document, and for the least expensive plans in this Medigap plan summary. Both of these documents can be accessed through a link on this website. You can also go to a local insurance agent to buy a Medigap policy. You can find their phone numbers in the phone book or on the internet. Well, a competitive premium is an important consideration in choosing a Medigap plan. Other information shown on this slide may also be valuable in making your choice. For example, you might favor a company that's been around for a while or has a strong financial stability as measured by AM Best. Or maybe a household discount is important if both you and a number of your household are planning to get the same plan. Perhaps the number of people the company covers nationally with Medigap policies is important. As shown on this table, United Healthcare has by far the most Medigap policies in force in the United States. I recommend that you call the companies or go to a local insurance agent to confirm the information in this and the previous slide. While you do this, you can ask if the plan has automatic crossover or other benefits like a gym membership. Then enroll in the one that best fits your budget and medical needs through a local insurance broker that represents the plan of your choice, or through the 800 number provided in the DORA document or Medicare summary ship, Medigap summary ship document, both available through links on this website. Let's talk just a little bit more about automatic crossover. SHIP believes that automatic crossover is an important consideration in making your choice. Automatic crossover means that the provider sends the bill to Medicare, which pays its part, and then forwards the bill to your Medigap company, which will then pay its part and send the bill back to your provider so you can pay the remainder, if any. Without Medicare automatic crossover, Medicare will send the bill back to you after paying its part, and then you must send the bill to your Medigap company, and this complicates and confuses the whole process. So we SHIP navigators strongly prefer plans with automatic crossover. So we are ready now to leave port 2, the Medigap port, and head for the Medicare Advantage port on the island of secondary health insurance. By now, you should be able to decide if you want a Medigap or Medicare Advantage plan, when to enroll in a Medigap plan, what level of Medigap coverage best fits your medical needs and budget, and which companies are best for your preferred coverage. I know we've covered a lot of information in Port 2 on Medigaps. If you have a question about Medigap, also called Medicare Supplement Insurance, set up an appointment with a SHIP navigator or a local informed insurance agent. Okay, we've arrived at Port 3, Medicare Advantage. As I noted earlier, about equal numbers enroll in a Medigap and a Medicare Advantage plan nationally and in Colorado. If you choose to be in the Medicare Advantage camp, when can you enroll in a Medicare Advantage plan? Most will enroll in a Medicare Advantage plan during their initial enrollment period at age 65 if they are retired, or earlier if they're on Medicare due to disability. The initial enrollment period is the month you become eligible for Medicare, plus or minus 3 months in general. For those of you who work past their initial enrollment period and are covered by credible employers insurance, you can enroll in Original Medicare Part B and a Medicare Advantage plan during a special enrollment period when you retire, and lose that credible employer's insurance. The special enrollment period goes from 2 months before till 2 months after you lose the employer's coverage. If you should miss the initial and special enrollment periods, you can also enroll in a Medicare Advantage plan during the annual open enrollment period, which lasts from October 15th to December 7th every year. You will not be subject to underwriting should you do this. During initial enrollment, special enrollment, or annual enrollment, your enrollment in a Medicare Advantage plan is guaranteed. The company cannot deny you coverage, charge you more than the general market, or put a pre-existing condition clause on your policy. You can sign up for a Medicare Advantage plan by going to a local insurance agent or by doing it yourself with the assistance of a SHIP navigator at Plan Finder on the website medicare.gov. You can access Plan Finder through a link at this website. Why might you choose a Medicare Advantage plan over a Medigap plan? First, the monthly premium is $0 per month for most Medicare Advantage plans, regardless of age. Premiums for Medigap plans for a 65-year-old range from $30 to hundreds of dollars per month, depending on the company and degree of coverage, and will increase with inflation and age. So for a healthy person, a Medicare Advantage plan will be less expensive than a Medigap plan. Second, Medicare Advantage plans include preventative benefits not offered in Medigap plans. The more common preventative benefits are listed on this slide. They can include payment of health club dues, free preventative dental, vision, and hearing services, in some cases even glasses and hearing aids, and some level of reimbursement for over-the-counter supplies and supplements. These are all wonderful benefits, and you'll see them prominently displayed in advertisements and brochures for Medicare Advantage plans. But now, for the rest of the story, as Paul Harvey says, what is not to like about Medicare Advantage plans? First, a Medicare Advantage plan will usually cost you more than a Medigap plan if you need frequent medical services. Medicare Advantage plans have more deductibles, co-pays, and co-insurances for medical services than Medigap plans. Second, a Medicare Advantage plan has more limited provider access. A Medicare Advantage plan has a provider network. If you go outside that network, your medical costs can increase dramatically. Even if a provider is shown by the plan as in-network, a significant number of local providers, principally primary care doctors, labs, and home health care, do not accept Medicare Advantage plans. If your provider does not accept your Medicare Advantage plan, you'll be liable for the entire cost of the service. It's our experience that most insurance agents will look online and see whether the provider is in-network, but will not verify whether the provider will accept the plan. That will be your responsibility to confirm the information before signing up with the plan. So you must call your providers to verify they are in-network and will accept your Medicare Advantage plan before you enroll. Third, Medicare Advantage has a stricter definition of what is medically necessary than original Medicare and Medigap, particularly in the areas of lab tests, mental health services, and rehab stay lengths. For example, your doctor may consider a lab test as medically necessary, but the Medicare Advantage plan has the right to disagree and not cover it. For that reason, Medicare Advantage plans require providers to get prior approval for medical service to ensure coverage. Finally, most Medicare Advantage plans include drug coverage as part of the zero monthly premium. However, they may not cover your med or cover it at a considerably higher cost than a freestanding Part D prescription drug plan. So check to make sure that your Medicare Advantage plan will provide affordable drugs before you enroll. Listed on this chart are the Medicare Advantage plans currently offered in our area. New Medicare Advantage plans can be offered beginning October 15th of every year. So there may be more Medicare Advantage plans coming up later this year. A summary of important features from plans in October 2019 are shown on this slide. You can get a more current summary of Medicare Advantage features on a link at our website. You can also get more current details on Medicare Advantage plans at Medicare's Plan Finder, located at medicare.gov, or for the companies themselves. A link to the Plan Finder is available also on this website. So which of these Medicare Advantages is best for you? First and foremost, you must determine if your providers are in the plan's network and if your providers will accept the plan. A Medicare Advantage plan will cover poorly any providers that are outside the network and will not work at all for providers that do not accept the plan. Call your providers to determine whether they are in the network and whether they accept the Medicare Advantage plan before you enroll in one. Based on our experience, the company or insurance agent may not give you this information. So it is your responsibility to confirm that your providers are in network and accept the plan. Next, decide whether you want an HMO plan or a PPO plan. The HMO plan generally has lower deductibles and copays than the PPO plan, but it will not cover you at all if you go outside the network unless you get approval from the insurance company, not likely, or the insurance company declares it an emergency situation. A PPO plan will cover you if the provider is outside the plan network and will accept the plan, although the deductibles and copays will be higher than if you stay in network. Therefore, more providers are available in a PPO plan than in an HMO plan. Third, take a look at your maximum annual liability with the plan. You may reach that maximum annual liability if you're hospitalized, have a major inpatient surgery with lengthy recovery, or need treatment for cancer. All Medicare Advantage plans are required to have an annual maximum out-of-pocket for medical costs, which will be the sum of all medical deductibles, copays, and co-insurances you pay in a year. Your maximum annual liability, if you meet all the conditions of the plan, is limited to this amount. The maximum liability of the available plans currently ranges from $4,100 to $6,700 per year if you stay in the network. If you decide to go outside the network, use a provider that does not accept your Medicare Advantage plan or have a medical service not covered and approved by your Medicare Advantage plan, your annual cost can be higher than the maximum annual liability shown in this chart. Fourth, compare the deductibles and copays for services that you are expected to need. They do vary from plan to plan. Finally, make sure that the Medicare Advantage plan covers your medications at your preferred pharmacy and at a competitive price. We'll talk later in the cruise how you can compare prescription drug costs among the Medicare Advantage plans. Now let's visit covered preventative services, which is the main benefit of Medicare Advantage plans over Medigap plans. Some of these are summarized in this slide. They can include routine dental, vision, and hearing appointments, in some cases glasses, hearing aids, payment of health club dues, some level of reimbursement for over-the-counter products, and more. Check out the two links at our website, Plan Finder or the Medicare Advantage Plan Summary, for a current list of preventative benefits. Prefer the Medicare Advantage plan that offers you the best preventative benefits for you, as well as the necessary medical benefits that you'll need to take care of your medical issues. Recognize again that the providers of preventative benefits must be in the network of your Medicare Advantage plan and must accept the plan. A list of providers for these preventative benefits should be available on the network for the plan or available through a phone call to an insurance agent. A negative answer to either of the questions, a provider not in the plan network or not accepting the plan, diminishes the value of these preventative benefits to you. Well, that was a long stay on the island of secondary health insurance, but we're now ready to set sail to our next port, prescription drug coverage. Hey, you may need drugs by this time on this cruise.
There are a number of ways to get your medications at less than retail price. A Medicare prescription drug plan will typically save you money on your meds, particularly if you're taking any brand drugs or more expensive generics. About 85% of Medicare beneficiaries will get prescription drug insurance sometime while they are on Medicare. Medicare does not require you to get a prescription drug insurance plan. However, if you do not get a prescription drug plan when you are eligible during your initial enrollment or your special enrollment periods, Medicare will fine you if and when you do get a Medicare prescription drug plan sometime in the future. The penalty equals about $4 added to your monthly premium for each year that you were eligible for a Medicare drug plan, but did not have one. So, if you go for 10 years without a drug plan after you were eligible and then decide to enroll one, you will pay a penalty of $40 each month, $4 times 10 years, for as long as you have a drug plan. There are other ways to get your meds at less than retail cost, in addition to or in place of your prescription drug plan. These options are listed on this slide. A ship navigator will typically look at all options to see the best way for you to get your meds. Your pharmacy has negotiated its own price for a med, and while you're at the pharmacy, check with a pharmacist to determine if you're taking the brand or generic form of a med. If you're taking the brand form, discuss with the doctor whether you can take generic, which will almost always be less expensive than the brand form. Coupon programs have negotiated their own prices for meds. We find that GoodRx has been the best of the coupon programs. Drug manufacturers and nonprofits have patient assistance programs to reduce or eliminate the cost of meds if you satisfy the requirements of their programs. The website Needy Meds is a good reference for these patient assistance programs. Finally, some will travel on vacation to a foreign country to get a med that requires a prescription here, but does not require a prescription in that foreign country.
If you plan to enroll in a prescription drug plan, you have several options. Most group health insurance plans, like Para, VA, TRICARE, FEHB, and active employers plans, will have drug coverage. If you do not have the opportunity to get a group plan, you can opt for a Medicare Advantage plan, which will also typically have prescription drug coverage. However, if you opt for a Medigap secondary health insurance plan, or you are on Medicaid and you want prescription drug coverage in either case, you will purchase a freestanding Part D prescription drug plan. So what is a prescription drug plan? It covers prescription drugs that you pick up at a pharmacy or at mail order. A drug plan can significantly reduce the amount you have to pay for a medication at a pharmacy, particularly for brand drugs, inhalers, and insulin. It does not cover drugs used in the hospital for the reason you are there. Those meds are covered by Original Medicare Part A if you're an inpatient, and Part B if you're an outpatient. Also, it does not cover over-the-counter drugs. You can purchase a prescription drug plan from an insurance agent, or you can purchase one with Medicare's Plan Finder, which can be linked and accessed at our website. Because drug plans change every year, we encourage you to review your prescription drug coverage during the annual open enrollment, October 15th through December 7th, to make sure you have the best plan for the following year. We'll talk a little bit more about that later on the cruise. What factors do you need to consider when selecting the best drug plan for you? Well, make sure your meds are covered by your plan. That's called the drug plan formulary. And at the quantities that you use them. Check that the drug plan works at your preferred pharmacy. Do you need the plan to work nationally, or is it okay if it just works in your area or state? And finally, look at the cost of the meds, which includes a monthly premium for the drug plan, plus a yearly deductible, plus a copay or co-insurance for each medication. That is an awful lot of information to try to weigh. Fortunately, Medicare has developed a computer program called Plan Finder to look at all these factors and select the best drug plan for you, whether it's a freestanding Part D drug plan or a Medicare Advantage plan that includes drug coverage. You can access Medicare's Plan Finder at the Medicare.gov link on this website. Let me show you how Plan Finder works. First, bring up Plan Finder at Medicare.gov, sign up, change plans through our link on the website. Log in or create a My Medicare account. There are several advantages to creating a My Medicare account. First, the account can include a record of all your Medicare billings, and that record makes it easier to schedule future services as well as to identify fraud and error. Second, the account will keep a record of the meds you have billed to your drug plan in the past and make future review of drug plans much easier. Third, you can order a new Medicare card through your account if you should misplace it. For those reasons, we strongly encourage you to create a My Medicare account, although you can do Plan Finder without it. When you enter your My Medicare account, Medicare will show you your current Medicare drug plan if you have one, in this case the Humana Walmart Value Plan, and whether you have qualified for extra help from Social Security. We'll discuss the extra help benefit later, but it pays for the plan's premium and reduces the plan's deductible and drug copays or co-insurance. Plan Finder will ask you whether you want drug coverage under a Medicare Advantage plan or a freestanding Part D drug plan. Plan Finder will also ask you for your zip code, so it will consider only plans available in your area. On the next Plan Finder screen, you will enter the medications you are taking, including the dosage strengths, the form, whether it's a capsule or tablet, or extended release perhaps, and the frequencies that you take that medication. On the next Plan Finder screen, you can choose the pharmacy that you currently use. You can also add up to 4 more options, including pharmacies in your area, as well as mail order. Medicare's Plan Finder will take all that information you've entered and determine the lowest cost plan for you among the approximately 40 choices of freestanding Part D plans and 10 Medicare Advantage plans available to you. Plan Finder will show you the cost if you stay on your current plan and the cost for other plans ordered from lowest to highest cost. In this case, the Medicare beneficiary has been on the Humana Walmart Value Plan, and it would cost him $1,756 in premiums and copays for his meds for the rest of the year. If he can change to a Cigna Part D prescription drug plan, the cost for the plan premiums and drug copays would be only $368 for the year. So for a very short list of only 4 medications, he can save about $1,400 for the rest of the year by changing to the Cigna plan rather than going on his current Humana plan. It's very easy to enroll in a new drug plan. Push the Enroll tab and you'll be sent to a short enrollment application for the new plan. The application is sent electronically to the company that will manage your plan. In 7 to 14 days, you'll receive from that company your prescription drug plan card that you can show to the pharmacist, information on how to pay your monthly plan premium, and a large book on plan features. Medicare prescription drug plans change every fall. In addition, your meds will change. When you pair the changes to drug plans to the changes in your meds, there's a 60 to 70% chance that choosing a new drug plan for the upcoming year will save you money. Medicare allows you to make a change during annual open enrollment, which lasts from October 15th to December 7th of each year. Think Halloween, oh horrors, I need to look at my drug plan again. And then December 7th, Pearl Harbor Day, I'm sunk and must stay with my likely too expensive drug plan for next year. Go back to Medicare's Plan Finder each year during annual open enrollment to update your medication list and pharmacies. And then review whether your current plan remains the best for next year. And if appropriate, change drug plans. Last year, the Mesa County SHIP helped 1,300 clients with drug plan reviews during annual open enrollment. More than half of those clients saved money, and the total savings were $525,000 over the next year. While we are on the subject of saving money, let's sail to the next port and see if a financial assistance program offered by Social Security or Colorado's Department of Human Services might save you money on your medical and medication needs. The more common Medicare-related financial assistance programs offered by these two agencies are shown on this slide, along with the approximate income and asset limits for the programs. If you are on Medicare due to disability and are less than 65 years old, consider the first program listed on the slide titled Medicaid Buy-in for Working Disabled Adults. The definition of working is very broad, and the income limit is very high at $4,500 per month, and there is no asset limit. Under this program, you qualify for full Medicaid, including vision, hearing, and dental benefits of Medicaid. For others on Medicare, consider the other programs listed on this slide. If your income is less than $1,600 per month as a single, and $2,100 per month as a couple, and your assets minus your primary residence, its contents, and one vehicle per person are less than $14,000 for an individual and $29,000 for a couple, come talk to us about financial assistance programs offered by Social Security and the Colorado Department of Human Services. While SHIP cannot qualify you for these programs, we can screen your income and assets to determine for which you might be eligible and help you complete the applications to those agencies. Medical costs are the most common reason for bankruptcy among seniors, so take advantage of any financial assistance available to you. We are there to help you identify if you qualify for financial assistance and to help you with applications to the appropriate agency. And now we've come to the end of this Medicare 102 cruise. Medicare health insurance and prescription drug plans. We have cruised through a lot of murky Medicare waters on this cruise. Should you have questions on secondary health insurance options, coverage of prescription drugs, or financial assistance programs, please don't hesitate to call or email a Mesa County SHIP Navigator to discuss any of the questions you might have. Our telephone number and email address are shown on this slide. Thank you for sailing with the Mesa County SHIP on this cruise, and perhaps we'll see you on a future cruise. Bon voyage.